Morning, Rahul and Paul. How are you both this morning? Are you well?
Oh, excited to be here today.
Excellent, good. And you've had a good day this morning already, I believe?
Oh, it's been a fantastic start, I think, with Andy's presidential speech to welcome everybody. I think that was really motivational and inspirational both.
Yeah.
And I think Francesca started really well, so the audience, I think, are really enjoying that. Yeah. So a lot of motivation already.
Fantastic, good. And looking forward to the rest of...
Looking forward to the rest of the day. I mean, Francesca this morning was, I can only describe it, electrifying, actually. So it's so nice to see delegates come in first thing in the morning and unsure of what they're going to see, because I'm not sure. You know, one of the issues sometimes is people don't know who someone necessarily is. They read about them, and then she just engaged the audience within about 5 minutes, and it was just fantastic. So I think a very exciting day.
Yeah, I think she's created quite a buzz, actually.
She really has already.
Yeah, fantastic. So, moving on over the rest of the conference, is there any aspect that you're most excited about from here that you would particularly want to kind of mention?
Yeah, actually we've got a great panel tomorrow on really about ceramic dentistry. So we've got 3 speakers talking about that, giving their viewpoint of how they do things. And then we have a perio panel really about soft tissue management, because it's not just about the teeth but also about the actual gum health and then how that appears and the pink and the white. And we also have things available for the team, where we've got Tracy Stewart and we've got a fantastic speaker, Mike DeFrisco from US, on branding and actually creating a personal brand of excellence for your patients to see.
Excellent. So it really encompasses the whole team and everything about the business. Yeah.
Absolutely.
With regards to BACD, how are things moving along with regards to the growth of the society? And if you could explain to our readers and our viewers what your roles within the society are, starting with yourself.
Sure. So at the moment, I'm Vice President. Will be President-elect as of tomorrow.
Okay.
And my role as a Vice President has been the Financial Director, so I've been looking after the purse strings of the actual Academy.
Yeah, there's no mean feat.
So that's been my current role.
Yeah.
And as far as the actual growth Academy, we are the largest cosmetic dentistry organisation or academy, should I say, in Europe. So we want to continue the growth, and that's our aspiration, for more dentists to understand exactly what we do. And it's not just about creating whole smiles, but to make sure that everyday dentistry can be cosmetic, making sure that it should be cosmetic, because why shouldn't it be?
Yeah.
So we want to get the message out to all dentists and then people to know how to do it.
Yeah, excellent. And with regards to membership just now, do you know roughly how many members does the society currently have?
It was about 760, wasn't it?
That's right. That's impressive. That's good. Excellent, good. And yourself, Paul?
Well, I've been on the board for 6 years as well. I stepped off for a year. I had a busy year last year. My role before was conference director, and now I'm communications director. What goes forward, I don't know, because actually there's an election today, so we'll see. But maybe going forward, education perhaps next year if I'm still on the board, and who knows from there.
Okay. How would you say your involvement with BACD has changed you as a dentist? I guess clinically, but also just personal.
I think the most important thing to stress with the BACD is the educational value of being a member of an organisation like the BACD. So to be exposed to the speakers, to the level of education, can only make your dentistry better. I suppose one of the things that people often ask is, what does it mean to be a cosmetic dentist? And I think in everything we do, we should be thinking cosmetic. So from the smallest filling, you want to make it look good. So it's simple stuff. I mean, yesterday we had certainly 2 of the hands-on. One was posterior composites, one was anteriors, and that's just, that's the everyday stuff that everyone can do. And I think that adds value to anyone's practice. So it's just getting that across. We were talking before about people's perceptions of the academy when it first started. I mean, that's history. It really is about just getting that message out there. There's simple things that you can do that can be additive, straightforward, and not destructive.
Indeed, and actually I think this concept has been around, I think, a lot longer than we realise. I was doing some research on a dentist called William Dow, who was one of the forerunners in ceramic dentistry, And some of his comments were fascinating because he believed his techniques weren't good enough yet, and he'd stopped performing ceramics. This was in like 1890. He was producing blocks of ceramic and drilling out the piece through measurement with calipers and then fitting them. But he said he had to start again because his patients no longer wanted to show gold or amalgam, and he was forced back into improving his ceramics because of demand.
Well, it's very interesting just hearing, again, Francesca starting this morning, very generically speaking about what she does and how her pathway. So she started as a prosthodontist in America, and that was very, as she would say, subtractive training. Yeah. So they would approach cases as full rehabs and destroy teeth, essentially. I mean, doing fantastic work, there's no doubt about that. But then coming to Geneva and working with Pascal Manier, someone who she didn't know who he was, and learning about bonding, but showing her first cases, not really knowing what she was doing. I mean, that was great about that presentation this morning, is this is what we did, someone guiding me and showing me, and just adding. And it, and getting, obviously, and she can show case after case after case after case, and it works, and changing her whole philosophy, how she's been taught. So, and I think, again, just getting that over to maybe some of the younger dentists who embrace that stuff.
Yeah. And I think that's one of the things that I've witnessed looking in from the outside to BACD is that I guess that environment of the dentist being willing to share their information. A lot of very, very talented dentists who there's no holding back secrets. This is how we do it.
I think the key thing is that the environment that we created at BACD is where the speakers or even the board or people who have actually been lecturing in the past integrate with young dentists or up-and-coming dentists who want to learn, not just in an educational environment as in the lecture hall, but also networking in between the actual seminars and lectures, and also socially, where there's a lot of conversation occurring about what do you do in your practice and how do you do it, and this was a situation I faced, and this was the issue that I couldn't tackle. Can you please help me? So that level of interaction is fantastic, and support level that it creates overall to like-minded dentists, and whether you are at the same level, above, below, doesn't really make a difference.
Of course, yeah. And again, as I say, one of the best things I'm hearing today is that idea of it not just being about the complex things, which I think sometimes dentists might get the perception that cosmetic dentistry is all about the complex case. Which it clearly isn't.
It's just about everyday dentistry. But that's just what Rahul was saying about the cap, and I think our reputation really is built on that sharing. That's absolutely. How we've, a big part of coming to conference is not just seeing this fantastic speaker, which undoubtedly she is at the tea break speaking to a colleague, saying this is what I do, I have trouble with this. And I think that's the philosophy. And
you can very much feel that in the exhibition area, in the lectures. There is a camaraderie among the people that are actually here. It's a great environment at these conferences.
I think that openness and that friendliness has been the ethos right from the beginning, and I think that's carried on and grown even further. Yeah. So I think people really look forward to that as much as seeing the speakers as well, I believe.
Yeah, absolutely. Is there ever in the programme lectures on techniques for dentists to manage patient expectations? Obviously there's very much the clinical side of it, but as we very well know, our idea of good cosmetic dentistry and the patient's idea can sometimes be skewed slightly. So do you ever do anything with regards to patient communication techniques and that type of thing?
So actually yesterday's hands-on lecture, I'll allude to Phil Reddington.
Yeah.
He was really talking about treatment planning and using diagnostic wax-up to actually to create the correct patient expectation. So certain situations may involve metal frameworks in the dentistry provided, or it may involve where the tooth is a little bit longer than planned because of the bone loss in the gum tissue environment, and that was communicated and is communicated, I think, not just as a simple standalone lecture, but throughout the teachings as we go along.
Of course.
I was with Amanda Say yesterday afternoon, and she's talking about class 4 composites, but then she's talking about composite makeovers, and then just saying to your patient, how would you like me to finish this tooth? Do you want all this anatomy in there? Do you want it looking, just simply that, not just sit down, do it, and say, here you go.
Yeah.
Just make sure you have that conversation with someone first, so you know what, you might not need to put tertiary anatomy in that central incisor. It just might need to be nice and plain. What's the patient want? Make sure you know that before you start and finish.
I think that patient expectation on cosmetic dentistry does need to be clinically led, as opposed to just a communication lecture from somebody who just talks communication, because they don't really do the clinical aspects. And each patient is individual, and their specific requirement may be different, and therefore creating and understanding that patient expectation is something I think is part of almost every single lecture that we go through.
No, I would agree, absolutely. And I think that partly comes with experience, but also I guess quite important to get that ethos across to the younger dentist, that it's, as you say, it's not a standalone thing. It's often the patients that don't seem particularly worried about the cosmetics where you fall foul. Oh, it's fine, just whatever you think, and that's when you run into trouble.
Well, I was talking to someone yesterday who was asking me, who's just started in, got a relatively new practice, and I was talking about the fear of presenting what's the best solution. So he's all in his mind, because he wants to get the patient to come and sit in his chair, is compromising what he could perhaps do because of the fear of presenting what it might cost, but what is the best solution. So let the patient make that decision, present what you should be doing, and then take it from there.
Yeah, that's good advice. With regards to the future of cosmetic dentistry, what do you have any ideas or visions for the future? Obviously, the progress of digital dentistry is going to have a huge impact, potentially.
Absolutely, that is rocketing massively in every area, and as technology advances, that will only improve in quality. I mean, Paul's been a big advocate of digital dentistry in this practice, so he's been using that sort of form for several years right now, and then evolving as it improves. So I can only see it grow and will become the norm of not just cosmetic dentistry but all dentistry.
I mean, I was at IDS 3 years ago, looking at systems. There was very little choice. There was going there this year. I mean, it's exploded. So we're seeing that grow at a massive rate, and the influence. Things like DSD and Smile Design, being able to do that systematically within software, digitally, and being able to present that to a patient and give them an idea of what they're going to have before they get there. It's just
it hits on the predictability and the expectations and all these things.
You were talking about patient expectation. Well, that's just a great way of managing that. Here you are on the screen, this is what we can realistically do, and that way of being realistic, you can send a model into a technician who can do a wonderful wax up, but sometimes how realistic is that? You need to trial it in the mouth. So I think it's going to grow hugely, and we've got to embrace that.
Fantastic. Okay, to sum up, I guess, what would you, any of our readers or listeners that are viewers that are looking at this, if you were going to give BACD a pitch and say, come and join us and get involved, what would you say to them right now?
I think it's a place for fantastic learning, excellent speakers, great motivation. Dentistry can be difficult, lonely, and sometimes challenging with patient demands. And this is one where you can actually get different ways of dealing with that, being charged up to actually face any encounters that you may have for the following year. And great way to meet like-minded people, be inspired, and be with colleagues who actually want to carry on a journey of excellence.
Fantastic. Well, I feel inspired talking to you. I recently wrote an article about rekindling your relationship with dentistry, and I think events like this do exactly that. Come and learn, engage with fellow dentists, and enjoy your dentistry. Feel pride in what you're doing, and know that you're doing the right thing. And that's very much the message I get from you guys. So, thank you very much for chatting today, and I hope you have a great rest of your conference.
Thank you.
Enjoy.
Thank you very much.
Thank you.